Good afternoon, everyone. I'm Barbara Hamm Lee. When you think about health, what comes to mind? Losing weight, exercising, not smoking, taking medications. But do you think about your zip code, the water you drank this morning, the color of your skin, or the latest terrorist attack? Societal issues affect your health and well-being more than you are aware, and there's research to back it up. Dr. Dwayne Proctor with the Robert Woods Johnson Foundation joins us to talk about what it means to create a culture of health. Stay tuned. Another View is next, right after this news from NPR.
Discussing today's topics from an African American perspective, this is Another View.
Hello, everyone, and welcome to Another View. I'm Barbara Hamm Lee. So I hope many of you were not flooded out and that you're enjoying the fact that we have some sunshine this afternoon. It's a welcome sight. It absolutely is. So pick a disease: high blood pressure, diabetes, stroke, heart disease, and more than likely, African Americans and Latinos are at the top of the list of those who will get it and are more likely to die from it. Now, why is that? It's not always genetics. Many times it's our environment. From racism to stress to violence to the skin you're in, our environment is making us sick and killing us early. So how do we turn things around? How do we look at the intersection of our physical and mental health and our daily living in a different way? Joining us today is our favorite cardiologist, Dr. Keith Newby. Hey, Keith.
How you doing?
I'm doing great.
I like that title.
To have you.
I like that title, favorite.
Exactly, our favorite one. Absolutely.
Not the fact that I'm the only one of you.
And you're the only and our favorite. Absolutely.
Okay, I'm going to take that and run with it then.
And joining us by phone is Dr. Dwayne Proctor, Senior Advisor to the President of the Robert Woods Johnson Foundation. How are you, Dr. Proctor?
I'm doing very well, but I'm hopeful to become a favorite. So
Absolutely.
I'm going to work on that.
Hold up now, man. Got to let me enjoy this for a little while now.
Mm-hmm.
But actually, I will share with our audience, Lisa Godley, my producer, and I had the privilege of going to the National Association of Black Journalists and National Association of Hispanic Journalists Convention back in August. And we attended a session that Dr. Proctor did on health equity, and it was dynamite. And it really, Dr. Proctor gave us an opportunity to re-examine how we have been covering health on Another View. Every fourth Friday of the month, we talk about a health issue that affects particularly the African American community. And your session gave us an opportunity to really rethink how we talk about health and what things are really critical for that. So for that, we want to say thank you to begin with.
I'm gratified. Thank you.
So the question is, when we say health equity, what does that mean?
Health equity means removing the barriers, these persistent barriers in our society that makes it harder for some folks to achieve the life that they deserve. These barriers are often rooted in discrimination. They are often rooted in policies and structures and the way our communities and our society at large are designed. From our perspective, there are non-medical determinants of health, and that these non-medical determinants of health are more impactful than on health and even preventing health. They could be than is medical care. And the examples I could give you is this: if you live in a community where you do not have access to fresh foods that are appealing and affordable, okay, and you don't have sidewalks in your community, so the idea of going for a walk is prohibitive, or maybe you do have sidewalks, but vehicular traffic or other reasons prevent you from wanting to go for a walk. These are things that are available in other communities, but not all of our communities. And same with our school system, same with our employment systems and income systems. So taking a look at these non-medical determinants of health as systems, meaning they are policies, practices, and procedures Okay, and then dissecting them to say, how can we improve those systems that so that they can work better, but also how can they work better together? Because most times, most people's health aren't affected by one system's failure. It's not just because of the education system, but it may be education and housing and public safety and community environment. How do we look at them all together and then start to raise up some solutions that will help all of us have a better opportunity to live a healthier life?
And this affects everyone across the board, because I can hear some people in their mind thinking, "Oh, here we go. We're just talking about poor people again." But that's not necessarily the case.
No, not at all. I mean, if we just look at our healthcare cost, okay, when we have people in our nation who, for whatever reasons, do not have a primary care physician, do not get the proper referrals to go on to specialists like our favorite cardiologist and others, okay, and are reliant on the emergency room. Okay, are reliant on this urgent care that needs to happen for things like a common cold. But this is where they have to go. That affects all of our healthcare costs, okay? That affects the ability of those who might need urgent care in an emergent situation. Now there's a line, and of course our medical professionals know how to triage and get people the care that they need when they're there. But just taking a look at that and kind of understanding that among many of our people, whether they're poor, whether they're seniors, whether they're young, that there are barriers out there that keeps them from getting the help they need, and it does affect us all. I think you heard me say in the session that if my kid goes to a school with your kid from another part of town, your kid has a cold, sneezes on my kid, now my kid has a problem. And it's the same thing when it comes to how we look around about health in general.
So when you talk about the disparities that we face in terms of environment and so forth. I mean, Flint, Michigan immediately comes to my mind because to me that's like a huge one where the water supply now is contaminated with lead, and these children are dealing with lead poisoning and so forth. But bring it down to more of a day-to-day basis. Give us some specifics of some communities and some disparities that are happening, and then we'll talk about how people are starting to address that.
Okay, that sounds fine. And I'll start with going from my perspective about these non-medical determinants of health, right? So when residents in the Deep South have an average life expectancy 3 years shorter than other parts of the country, we have a problem, right? When African American workers earn 59 cents and Latino American workers earn 70 cents for every dollar earned by white Americans, we have a problem, right? And when people who are poor or live in rural areas, they're less likely to be covered by Medicaid than people in cities. We have a problem. So I don't so much focus on the disparities in terms of diseases like hypertension, cardiovascular disease, and others. I look at the disparities in these systems here and think about how does this impact health and how can we correct these things?
So the shootings that have been going on lately, that type of stress clearly would be another one of those determinants in terms of how people are trying to be healthy, but yet you still have all this stress in your life that's going on. That's
right. So I'll look at a community environment and look at it from the point of view, not just from the ecological environment, what's in the air, what's in the water, right? I'll also look at a community environment from the social aspects there and where the stressors come from in that way. I'll look at public safety broadly and the stressors that come from that. Now, I grew up in Washington, D.C. I'm a Washingtonian in that way. And when I'm at home and I hear sirens like every 20 minutes, those are all triggers for stress. When the bus is late to take me home, okay, and I'm there and I know I have to get there to get to my kids on time, and I'm depending on these transportation systems in our cities and our towns, that brings up stress. Stress is a leading cause of bad health, but stress is also impacted by those non-medical determinants of health, it makes living life stressful, which impacts all sorts of our bodies in all sorts of ways.
You know, it was interesting. We were having a conversation in our pre-production meeting today, and we were talking with our audio engineer and our intern. They're both African American males, and they were talking about what it's like when they're driving down the street and they see a police car, and how they will take their foot off the gas, they'll pull over, they'll, do various things. But what was most interesting about that conversation was that they said it's innate. I mean, it's such a response that is so natural to them now that they don't even think about it, but they just do it. I mean, that stressor there, it also, I guess my point is, it just really gets literally under your skin.
Literally, and when some people have to experience that as part of their everyday life, and others do not, then you start to see these disparities. And that's a big problem on our side. So at the Robert Wood Johnson Foundation, we've made a commitment to building a culture of health in America and working with others to do so. How do we pull together people from other aspects of society, whether business or government or directly from our communities, our young people, and start to talk about solutions to these problems? Not so much talk about the problem, but talk about the solutions. And it gets us a little bit further in terms of fixing the many, many types of problems that we have.
Okay, and we're going to talk about solutions in just a minute, but go ahead, Keith.
Oh, yes. One of the bigger problems we run into on the ground level, kind of dealing with it from, day to day, is such a multi-factorial problem that goes, a lot of what you brought up, a lot of what we see in the medical field, which is, you have it's almost like this psychosocial problem starts to impact, the patients and their perception of what they should and should not do when you're trying to change this more than just the culture of the healthcare delivery system, but you have to change the culture of the patients that's receiving that care. And I run into this on an everyday basis. And my older brother's a primary care physician, and he and I have our little nightly, communications about what we experience that day. When you see somebody that they'll come in, they'll tell you one thing, it's different. They're 100 pounds overweight, and you can't get them to cut back on certain types of foods, and you run into this issue with it, and it's really, and the thing is that I understand, and I tell other docs from other cultures, I say, a lot of times we'll all get around the table, becoming frustrated trying to take care of patients. But I say, the problem is the culture. How do you change that part? I said, people are doing what comes natural to them, is what they've been exposed to all their life. I said, we can't, hold grudges or be upset with how they were brought up. I said, that's something that the system, I hate to use that term, but the system has created this and trying to break that cycle, and you had to start somewhere. So trying to fix the system is going to be one thing, but then trying to fix the receivers of the system. When I say fix the culture, how they perceive what they're receiving. How do they say, okay, instead of eating this, I'm going to eat that? And a lot of times, and I run to, especially some of my older patients, guys, and well, actually men and women, they're like, man, I'm not changing what I'm doing. I've been doing this for 80 years of my life. I'm not changing a thing. I'm going to keep doing it. And, all we can do is, what I've learned to do is just a soft, steady, consistent, comment. I don't change. I don't get frustrated. I just say, something, I hear what you're saying, but I throw the guilt trip on people. I say, you're the husbands. I tell them, I said, listen, you have a wife, you have children, you owe them, to be here. I mean, I would usually, my patients know how I am with that. I take that part very seriously and trying to change that dynamic. And I try to appeal to that sense of right and wrong, say, listen, I need you to change this part, because if you continue down this path, the way you're doing, your life is going to be markedly shortened. I said, you've already had one stroke, you've already had one heart attack, and yet you're still smoking, you're still, at Popeyes and McDonald's every other day, eating the wrong things there. I said, you're going to have to change this. But that is, in my opinion, one of the toughest things, is trying to, almost have, you don't know where to start. Do you get the young kids, because they're the ones maybe the most easily influenced? You still try to, to of course help everybody, but that culture change, that is the bane of our existence in Well, in
Well, I'm
medicine.
curious, Dwayne. Is the medical profession, is that another area that has to be worked on also? When Dr. Newby talks about having to get doctors to also buy into this whole idea of a culture of health as opposed to just here, take this pill.
It's the medical professions. I think they're doing the best that they can under extraordinary circumstances, and there are many who do resonate with this idea of culture of health because they realize that part of building this culture of health means how do we transform and integrate our health and healthcare systems? And what I mean by this is that we know from research that 80% of your health is determined outside of the doctor's office. Okay, we know that we have institutions in our communities that are respected that are also very helpful in improving health. And I'm talking about faith places where people will feel comfortable exercising with the rest of the congregation, community centers that may offer blood pressure screenings or hypertension fairs and those types of things. How do we bring those two closer together, the medical side, the healthcare side, and the health side? Because prevention is really is going to get us where we need to go. And so that the healthcare side isn't so burdened because we're able to do the same things the doctors talk to us about. How do we make these little subtle changes in our lives that are really going to make things better? And what I really did appreciate from hearing from Keith just now is that this idea that patients are non-compliant, okay, that are held by some physicians when it really isn't non-compliance. It's not knowing what to do, not having the capacity to do such things. We were talking about Flint a second ago, right? And my doc tells me, you know what, you need to drink a little bit more water every day. But if I lived in Flint,
Yes.
Right? And I don't want to have anything to do with water.
I know. I'm feeling you on that one.
Exactly. 440-2665 or 1-800-940-2240. We're talking about creating a culture of health. And I would love to hear from people in Hampton Roads. If you are working within the community, if you're doing things to help create a culture of health, give us a call. Let's talk about it. 440-2665 or 1-800-940-2240. So, Dwayne, tell us some of the things that that communities are doing. Let's talk about some of those solutions.
Okay, I've got some. So in Oklahoma, just the whole state of Oklahoma, state health organizations and community leaders are making sure that health equity figures into everything that they're doing to improve the lives of their residents, right? So they're making certain that transportation is affordable and also rerouting public transportation so that it goes into all of our communities that would use them and that those routes also take them past the things that will be helpful, whether it's a grocery store and a supermarket, whether it's near where the local medical center is, whether it's to a park where people can be outdoors and be active in their lives. So now you have state health officials working with the transportation people. The transportation people are also focused on issues of food. The Oklahoma State Health people are also focused on food security. How do we make certain that if you don't have a grocery store, can we get a farmer's market? And if you get a farmer's market, that means that the money is going to local farms and farmers, and you're actually keeping money in the community. And those farmers markets could be sources of jobs within a community. And so thinking about the economics that go along with that as well. And in Oklahoma, they're making certain that the public housing projects are tobacco-free. Now, in Kansas City, the health department saw a report that showed that white residents were living 6.5 years longer than African Americans. And so city officials got together with nonprofits, business leaders, and they started to have tough conversations on once again, some of the non-medical determinants of health. They started talking about racism and structural racism. They started talking about community violence, how to create more educational opportunities, healthcare access to healthcare access and economic justice issues. And I just returned from San Francisco where I saw something I'd just never seen before, and I got to tell you about it, right? Public housing projects are being torn down, okay, section by section, and they're being rebuilt up okay, as mixed income rentals.
Mm-hmm.
So those residents that were in the public housing projects are getting new places, okay, and their neighbors are going to come from middle class or affluent people who want to rent in those same areas.
Yeah, we actually have a development here called Broad Creek that has done that same thing. Yeah. Mm-hmm.
Yeah, so you can see it in action, and this whole idea of that. How do you improve a community by taking seriously this idea of what does mixed income bring you? And in San Francisco, these houses, they got $1 million views looking over the bay. So it's not like how we see housing projects are in some areas, like in Washington, D.C., where I grew up, which basically seems to be isolated from some of the better parts of the city. This is keeping in mind and giving respect to the people who are there. But they've also found that they've needed social workers and others to come in and help the families that were in the public housing units to help them understand what their new community norms might be. How do they interact with different types of people that they haven't had to do so in such a social way before? And so it's not so much you can just build it and they will come, but you have to build it, and you also have to work with the residents to make certain that this community is exactly what they want. And that's the crux of health equity. You don't do something for people, you do something with people. You talk to the people who you're trying to help and understand from their perspective the things that will make their lives better, and work with them to implement it. And things go a lot further when you can do so.
So, Dwayne, I'm the chair of the Board of Commissioners for the Norfolk Redevelopment and Housing Authority. And this is a conversation that we have been holding and continue to hold as we are trying to move in the very direction of some of the things that you talked about. But what I'm curious to hear from you is, how did San Francisco, for example, pull together the politics, the political forces, and others to get rid of the NIMBY idea, to convince people it's okay to do this mixed income? Can you talk a little bit about what brought them to a place where they recognized and acknowledged that the culture of health was really important to do?
From what I understand from when I was there, was that the great effort was made to not just take data and say, look, this is what happens when this is in this way, but to do, as we were discussing, how do you make it real for those sitting around the table to say, this impacts your businesses, okay? If the school systems in this particular area aren't serving our children well, where are your employees going to come from? Where are your consumers going to come from? You can tell that to the business person. You can tell the bankers. Bankers will say right now, we have a problem that people aren't saving any money in our banks, okay? And then we say, well, you know what? You may want to start looking at the education system to say, how are they preparing young people to go on to either college and professions or professional vocations so that they have the income and can save. And also talking to those banks about putting their banks in the locations where the people who they want to attract as consumers can get to them, so that we're not dealing with payday lenders and other types of ways that really do, in my opinion, cheat people of their good hard-earned money. But the point is making certain that health is a shared value by the people around the table, and that they understand that it's going to take multi-sector collaborations to get the job done. And so it's not one person's responsibility. It's not the community development person's responsibility solely to make that housing project a healthier place. They're working alongside the health system. They're working alongside the business people. And you mentioned political leadership. Political leadership and political will to get the job done is absolutely essential. If you don't have that, you can't change zoning ordinances. If you don't have that, you don't have that motivational inspiration and that person who can lay out a vision, and a vision that goes further than just 5 years, goes 10 years, 20 years, and start thinking about what this means for the next generation of young people and families that are coming into those communities. And when you can have that conversation about what are our values, okay, and what and do we think that this is important, and then take the responsibility off of any individual to make the change and say we can only make a change if we go about this as a team.
440-2665 or 1-800-940-2240. I know many of you have tried to call in. We were having some phone issues. I think we are reset and back in business, so try us again, please. 440-2665 or 1-800-940-2240. And if you're just joining us, we're talking about health equity with my co-host for Another View on Health, cardiologist Dr. Keith Newby, and Dr. Dwayne Proctor, senior advisor to the president for the Robert Woods Johnson Foundation, and his special project is called Creating a Culture of Health. So,
yeah,
Keith,
one of the things that I know that I run into as a cardiologist, and one of the things that I've tried to do, and Barbara and I are Facebook friends. She see me, I get up there a lot of times, and I will do kind of inspirational messages. I'll show myself out there doing steps around my office building. I actually stopped taking the elevator myself personally. One thing I've learned is a lot of times if people see you doing things, a lot of it is all about motivation. And if you motivate people want to do well, generally speaking. They just don't have that motivation, in their home environment. Nobody's there to, push them and help motivate them. So I kind of took on some of that myself, and I did that because I felt it was the right thing to do, secondly, but it helps keep me motivated, too, to keep moving and doing things. But I have found that, generally speaking, if you create a culture for people to follow, a lot of times they will follow it. A lot of people want to do right. They want to lose weight. They want to be healthier, but they don't know how to go about it, and then they don't have that motivation to do it. And that's really what I think holds a lot of us back, is just motivation to do the best for ourselves. So I look at it as if we create that environment for our people, our individual constituents, and the people that we live in our communities, a lot of people will turn around and do the right thing.
So, Dr. Proctor, why did the RWJF take this on as a project? Why are you doing this?
Well, there's a lot of different cultures in our American society, right? We've got cultures based on our backgrounds. We've got cultures based on our interest in our activities. We've got cultures of materialism. We've got cultures of politics. But there's no culture of health here. And we know that a culture of health, it sounds like a lofty ideal, an aspiration, a slogan. But when we can actually say that if we had these things in place, these things would contribute to making America a healthier place, right? So if voting participation is one of the things that we measure to see how close we're getting to a culture of health. If we have a more activated electorate that is focused on putting people in power who hold their interest with them, then that's a sign that a culture of health can flourish in that way. We look at policing. We look at policing to understand are there citizen review boards being set up in our jurisdiction so that when we do have these unfortunate incidents, and unfortunate is not the strongest word I could use, but I'm going to go with that one, right? So that when we have these unfortunate incidents, that there's some accountability. And accountability is in the hands of the people, not necessarily in the hands of the perpetrators or the hands of the politicians, because I will say for our police, and I know there are many good police out there, to have to be the social worker and the police officer, to have to be the community leader and the police officer, there is a role for everyday people to play in this. If we can, so we're looking at things like that to see how close we're getting to a culture of health. But we knew it was important because we can't keep working like this. We can't have the highest healthcare cost in the entire world and the worst healthcare outcomes than many, many, many other nations that are similar to ours. It doesn't make sense,
So I have a quick question, and then I'm going to go to the phones because they are lit up.
Right on.
This whole issue of heroin addiction, now all of a sudden, it feels like all of a sudden, this is a big deal that all these people are dying from heroin overdoses and so forth. But within minority communities, death from heroin has been happening for a very long time. So in terms of creating this culture of health, do you think that it will come a point where some things that are happening within minority communities in particular will rise up to the stature so that something can be done well before it has to happen to another community.
I think that's exactly what we're shooting for here. You know, when we can empower people, all people, right? Okay, to have an equal voice on issues. And like I said, I'm from Washington, D.C., so we experienced the crack wars. And I know that very, very well. And this new attention to the opioid epidemic, as they're calling it, it almost seems insulting in some ways, you know. And so that's another reason why this health equity approach is so very important, because we can even say that during this period of crack or heroin, that there is equality in America, right? But equality only got us so far, and it didn't get us far enough. This equity movement ensures that all of us have what we need to live the lives that we deserve, and that all of us have a position of power within the structures that exist to be able to help shape our community. So yes, I am absolutely optimistic that will be the outcome if we can see more health equity in America.
Fantastic. Let's go to the phones. Terrence joins us from Norfolk. Hi, Terrence. You're on the air.
Hi, Barbara. How are you?
Okay.
I'm so very pleased to hear you guys talking on this subject, and I believe that you just mentioned the Robert Wood Johnson Foundation. I didn't catch all of that discussion. But I was one of the folks selected out of 40 people across the country for that Culture of Health Leaders program.
Right on.
And I would encourage people to go to that website. You know, it is a very insightful approach that I think that the Robert Wood Johnson Foundation has taken to address the health disparities that impact the country, particularly in terms of helping people to identify the social determinants of health and how they might, in fact, be personally impacted by it. I'm very excited to be a part of this program, and the thing that I'm particularly excited about is the training that they're going to provide. So I would just encourage people to go to it's cultureofhealthleaders.org, and there's something, again, that's sponsored by the WHRV-FM.
Yeah, Terrence, just so you know, since you may have tuned in later, Dwayne Proctor is the special assistant to the president for RWJF, and he is overseeing Culture of Health and the initiative itself. So that's who we're talking with today on today's show. But very quickly, tell us what area you are focusing on in terms of the grant that you received.
Well, I will see Dr. Proctor, no doubt, in Princeton next week for the Fall Institute. My project as a prostate cancer survivor warrior, my project is something called PSA to PSA. As Dr. Proctor probably mentioned, it is a 3-year program, much of it dealing with training and helping people to develop their programs. My program, PSA to PSA, literally translates into prostate-specific antigen to public service announcements. In the first year, we'll do a pilot initiative here in Hampton Roads with the Hampton Roads Prostate Health Forum producing a public service announcement. And the second year, we will be replicating that project across the country in 6 cities across the country. And then in the third year, we will be using that material to develop a documentary addressing the African American prostate cancer disparity, which is alarming.
Okay. Thank you so much for your call, Terrence. I appreciate it. Dr. Proctor, anything you want to react to?
I'm thrilled and I'm surprised, and I can't wait to meet you, Terrence, next week. I really can. But let's go back to this point of health equity.
Okay.
This is a gentleman, okay, who knows what's needed to improve health in the areas that he works in, okay? And now he has the support of the Robert Wood Johnson Foundation to help bring that forward. And that's health equity. He had power. He always had power. We've added our power to his power.
And that's the key that we want to do, replicate across the country then, for all of us to help each other to be able to build this culture.
Power belongs in the hands of the people.
Love it. Let's go to Kenyana. Am I pronouncing that correct? From Newport News?
It's Kiana Lee.
Oh, Kiana. I'm so sorry.
Yes.
Thank you.
Oh, no, you're fine.
Thanks for joining us.
Of course. Thank you for welcoming me. My name is Kiana, and I'm at a local community college.
Uh-huh.
However, I have witnessed others just having a lot of health issues, right? And I've just seen such a success gap in education and in the healthcare system. And I would love for, my line of college or in my career to be devoted to improving the healthcare system. So there's 2 areas that I see right now. the huge funding in pharmacy. I don't understand why it's as big as it. I have two questions.
Okay.
I don't understand why it is as big as it is. The only way that I do understand it is because it's a recycling bin, in the sense of people coming off of street drugs, going into methadone, and then having to be on pharmaceuticals. And it's when people get off of it, through the withdrawal, there's not any programs that I know of in Newport News, Norfolk, Hampton area, Hampton Roads. Why are with any withdrawal centers, why are they either not here or very, very low in others knowing about them? Because people seem to be trapped on pharmaceuticals, on methadone, right? If that's the case, I believe that the answer in Hampton Roads, that's the only way I can speak of, is the home health care system, the mental health skill building, and home counseling, right? But if you're coming off of a drug, going through withdrawal, you're coming off of it, meaning that you don't receive Medicare or Medicaid.
You have a lot of different issues in this one question.
Well,
so let's hold on. I'm gonna let Dr. Newby answer you, and go from there. Go ahead.
I think in the end, Kiana, the system. This is an example of how the system has failed. Certain groups of people, and I have found, and actually even the mayor of Norfolk and I have discussed this as one of his initiatives he talked about was the mental health piece, and how there seems to be a problem with there being enough attention and time and money spent on dealing with that group of individuals. Like, how do you see these initial problems? And I can even speak to myself. I have a good friend I grew up with that has a major mental health issue that, I just say this 2-second story. I mean, he came to my office, this was several years ago, and he has a psychotic disorder, and he started just going interesting in the office, having an event. And we, fortunately so, I had to call the police. They had to come to the office, escort him off the premises. But then they just told him at the end, well, we can't hold him, so they just let him go. So what did he do? He just came right back up to the office again and started it up again. Had to get him to the hospital and try to, and then the healthcare system, at least the mental health system, it just would not do anything. So I'm sitting there, very frustrated because I'm like, listen, and unfortunately, so this guy may have been a childhood friend growing up, but his particular demeanor was one that I had to worry about the, safety and well-being of the patients in the office and the my staff, and I had no help. We're trying to deal with this, and there still is very limited help. So we still run into a problem that the only way we can really fix that is we got to bring awareness to it and then start pushing the envelope. And that's where the community, as Dwayne mentioned earlier, the community has to be that empowering body to say, okay, these are the changes we need to see made.
Dwayne, in terms of the various health issues and health areas, if we can address some of these environmental or non-medical areas, do we think that ultimately that will help to decrease some of these other medical problems?
I think so in some ways.
Okay.
Yeah, for example, if we can make certain that all of our people live in quality housing, all right, that all of our people have access to quality care and supportive services, so that things don't always have to fall into the doctor's office. It could be for these wellness centers for people who are suffering from addictions or living with mental health issues. If we can have our young people graduate from high school and go on to a profession or on to college or to a vocation that will give them an income in which they can live on, they can also start taking care of their health a little better. When we have to struggle with all of these different burdens and systems that fail us in our everyday life, we don't have a chance to take care of our health because we're focused on, I need a place to live, okay? I need a place to live that is safe. I need a place to live that I need to be in a community where I can feel comfortable. in. We talked about stress a little bit earlier, right?
Mm-hmm.
I have to have an income that's worthwhile. I'll tell you something that people may not think of as a health equity issue, and it has to do with the box that's on job applications that says that if I've been convicted of a felony or imprisoned in the last 10 years, check this box, right? Which is usually a screening out mechanism for getting a job. And so there's a campaign in philanthropy. Our foundation's involved in it. Others are doing the same thing called Ban the Box.
Mm-hmm.
Getting rid of that box on job applications could do a lot to improve health.
Yeah, as a matter of fact, I think in Virginia, for the state, I believe that the box has been banned actually on the application. So as the communities come together and as they're starting to pay attention to this, what are the biggest barriers that you've seen so far that keep a community from moving forward in creating a culture of health? What's stopping it?
One barrier is social.
Okay.
And it's something that we all go through either in our families or in our communities or in our workplaces, if that's the case, is that we tend to focus on problems. Okay, and because people want to express themselves about problems, and so you have to have that conversation, so we can get that out in the air. But shifting the conversation towards solutions and making certain that those solutions are ones that impact the systems, meaning the practices, the policies and procedures of our governments, of our corporations, of our even our emergency systems and things like that, right? And because when you can fix the systems to work better, and that they work better together, then you're going to have sustained change. A lot of times the focus is on, well, we need a program and we need an intervention. And the programs are only funded for a period of time, but the problem still remains because the environment hasn't changed. The intervention for 4th, 5th, and 6th graders, well, when they go on to be 7th, 8th, and 9th graders, and the next group of 4th, 5th, and 6th graders come in, the program's gone. And the problems still remain the same. The other barriers is a matter of inclusion. For many of my colleagues in public health, many of those who work in corporations in the private sector and government, they're not used to working with everyday people on solving problems. Okay, so that's what I mean by inclusion.
That was a nice diplomatic way of putting that.
Yeah, they're not used to it, right? So my grandfather was the mayor of D Street in Southeast D.C., right? Nothing happened on D Street without his
knowledge. Yes.
Right. So you can build anything. You can try to put it on D Street. It's going to fail automatically because you didn't vet it with the people first. You didn't ask the people if they wanted it. You just assumed that it was going to make things better. And so you improve the community. Then it gets gentrified and everybody gets pushed out. And everybody says, well, how did that happen? Because you didn't talk to the people who you were trying to help as part of the solution. So those are the barriers I see.
You guys have a really big job then, because this really does go to mindset change in terms of how things are done. So are you partnering with others to get the word out, or do you have a staff that's big enough to go everywhere?
There are only 270 of us really good people here at the Robert Wood Johnson Foundation. So that's not enough. We couldn't spread out across the country. Now, and this is why we emphasize fostering these multi-sector collaborations.
Yeah.
So we do work with other foundations. There's an excellent thing we set up. I'll call it the Executives Alliance for Boys and Men of Color, where 40 foundation CEOs have said they're going to make a difference in the lives of boys and men of color, right? So we work with philanthropy. We encourage business to come in our direction so that we can start talking about solutions to problems, but we make certain that they're sitting across from educators and others. And in California, a couple of years ago, 3 years ago, they passed a law that said there's no more out-of-school suspensions. Okay, so that if a young person misbehaves and it's a disciplinary matter, then their suspension is going to be in school. They're going to have tutors. They're going to learn yoga and meditation, kind of teach them some calming mechanisms so that they aren't so easily get off. Now, but think about their parents, those parents that would have to take off from work to be home with a young person, right? So now you're affecting the income of a family. Think about the parents who can't because they'll lose their job. Okay, and so the kid or the young person is at home playing video games, not learning, or walks outside, gets involved in the local criminal activity that may be going on, and then this young person now is going to cost the state $80,000 a year each year because now they're involved in the juvenile justice system, then the adult justice system. And so but making that simple change of just saying, no, that we're not going to have any more out-of-school suspensions has been enough to improve grades, improve dropout rates, meaning that there's less attrition in school. And it's just such a simple thing, but we would never have thought about it.
I think
Go ahead, Keith.
if you really think about what it really boils down to in simple terms is what Dwayne and the Robert Wood Foundation is doing is they're addressing the root cause, which is what, you and I've had these conversations before. If you just put a Band-Aid on a problem, all it's going to do is, it's not going to heal properly. You have to get underneath it, figure out the root cause. Like I say, if you put you cut somebody, you kid an artery, but you put a Band-Aid over, they're going to still bleed underneath it until you sew up the artery. You run into the same problem here. This is he's and correct me if I'm wrong, Dwayne, but what it sounds like you're doing is you're getting to the root cause, addressing the root cause, which subsequently will flow into the resolution of the problem as a whole.
I couldn't have said it better.
So we've got about 2 minutes left, and I can't believe how quickly the time has flown by. That's just, but Dwayne, what in this time frame? Say to the audience, give us something to really keep us thinking along these lines in terms of how we need to create this culture of health.
Two things. One is go to our website, cultureofhealth.org, okay, and look at our action framework. Okay, that explains exactly how we're looking at health, at building a culture of health, and also describes the drivers that need to be affected in order to see the changes that we want to have. It's a blueprint. It's not. We don't call it guidelines or regulations. We don't even say it's a map. It's like a compass. Okay. And use that compass to start making decisions. But then in terms of individuals thinking, start to think about these systems that are impacting all of our lives, and just pick one. Pick the education system, the employment system, income system, any system, and start to say, you know what? If this just changed like that, what could that do for our community?
What could it go from there? This has been a fascinating conversation.
Wonderful.
Dr. Dwayne Proctor, Special Assistant to the President for the Robert Woods Johnson Foundation. Keith Newby, cardiologist, and my favorite co-host. Thank you very much. Thank you so much for joining us today to talk about this, and we will continue conversations along this line, and we will be right back.
Hello, this is Spike Lee. What's happening? And you listen to Another View, 89.5 FM on WHRV.
And welcome back. There's a lot of history resonating from the walls of Fort Monroe in Hampton, Virginia. Built by enslaved labor, it would become a place of refuge for escaped slaves some 240 years later. Now, a new exhibit at the fort's Casemate Museum gives visitors a detailed look at this rich part of American history. It's called Contraband: Fort Monroe Becomes Freedom's Fortress. Our Lisa Godley recently explored the exhibit, guided by Museum Director Robin Reed.
This is before the Civil War, but it shows the spread of slavery in the South.
Walking through the Casemate Museum, you only need to reach out to touch the walls built by slaves. These same walls would shield them from capture almost 240 years later. They call these freedom seekers contraband, and the story behind that name is laid out in a telling exhibit at Fort Monroe's Casemate Museum. Museum Director Robin Reed begins our tour with a map showing where slaves in the South were located.
And you notice along the Mississippi and on the coastal regions and here in Virginia, there is a larger concentration of enslaved people. So obviously that's where the agriculture is going on. We know they're growing a lot of tobacco in Virginia. We know they're growing cotton. We know that they're growing rice. Keep in mind that of the whole southern population, about 1/3 of that was enslaved.
Virginia had just succeeded from the Union when General Benjamin Butler came to Fort Monroe. He'd been working one day as the new commander when 3 escaped slaves, Baker, Townsend, and Mallory, made their way across the James in a rowboat seeking refuge.
Steal away, steal away.
They go and plead their case to Butler, say, We just found out that our officers, our owners, are being deployed to the south. We're going to be removed from our families who don't want to go. We've run away. Can you give us refuge?
General Butler then meets with Major Carey, who represents the owner, who demands the slaves be returned under the Fugitive Slave Act.
And Butler says, that's fine. If you swear allegiance to the United States, I'll be glad to give you your slaves back. If not, my understanding is that you've formed your own new government. The fugitive slave law no longer applies to you because you're not part or under the protection of the United States Constitution. Butler also says, how are you using these slaves? Well, you're using them to build fortifications against me, correct? I'm going to seize them as property, as contraband of war, as I would horses or artillery or anything else that you use as material against the United States Army.
How did they know that coming here was a place that they could even ask for asylum?
That's a great question. This had always been a point along the Underground Railroad. It's a port. So we're having enslaved people being hidden on ships and being snuck away and moved up north.
Within days, news of the decision spread. Slaves first came to Fort Monroe by the hundreds and then by the thousands, earning it the name Freedom's Fortress. Museum historian Robert Kelly says it took a year to do the needed research to bring this story to life.
And before I'll be a slave, I'll be...
For me, it's just that it happened here, and that within this community, the story's not known, and within this country, the story's not known. And we have the opportunity to not only tell the story, but to tell the story where it actually happened, and people can experience the landscape, the fort, the buildings, much like they were in 1861.
The exhibit also looks at an amazing arc of American history, an arc that begins with the first Africans being brought to this very spot in 1619, to the contraband decision some 240 years later, a move that would set the stage for the Emancipation Proclamation. And it's because of the rich history. The arc ends with the first African American president signing a proclamation naming this former military installation a national monument. For Another View, I'm Lisa Godley.
There is so much history right here in Hampton Roads. If you have not had a chance to go over to Fort Monroe and to the Casemate Museum, take your family, go over, spend the afternoon. I think that you will find it amazing. The exhibit is fantastic, and we hope that you will join us over there. And there is just 1 week left before our next Race Let's Talk About It Town Hall. It's Saturday, October the 1st from 2:30 until 4 at Boyd Dining Hall on the campus of Virginia Wesleyan College. Our topic is Standing Together in a Culture of Fear. Now, it's free, but we do need you to please register. Go to WHRV.org/talkaboutrace and sign up there. And I look forward to seeing you there. And we will begin the conversation about standing together in a culture of fear next Friday with our special guest, TED Talk phenom Clint Smith. He will guide us through a conversation about the danger of silence, meaning what happens when we don't speak up when we see racist things happening. That's next Friday at noon right here on Another View. And remember, you can always take Another View with you if you go to WHRO.org and or to your favorite app store rather, and download the WHRO Media app. And you can carry us with you on your phone. Our theme music was composed and performed by Jay Sennett. Lisa Godley is our show producer. Victor Bowen is our audio engineer, and Nicholas Thomas answered our phones. I'm Barbara Hamm Lee. Thanks so much for listening, everyone. Have a great weekend, and let's get together again next Friday at noon for Another View.